15. That's the age in which the FDA has recently declared that someone needs to be in order to purchase over-the-counter emergency contraceptives. Today, I will be talking about emergency contraceptives and how the age has been reduced to purchase them and how this should still be corrected in order to prevent unwanted pregnancies from teens under the age of 15 in the United States. Knowing about what emergency contraceptives are, how they work, and why there should be no age on the restriction of purchase of emergency contraceptives, your knowledge will expand on women's health and possibly change the way you view contraception altogether. First, I will talk about what exactly emergency contraceptives are and how they work on the woman's body. Second, I will clear up the misconception between emergency contraceptions and abortion. Third, I will discuss the recent decision made by the FDA that reduced the age restriction to 15. Lastly, I will go over why the age restriction needs to be demolished to allow for equality for all women and their bodies. All right, let's get started. First, we need to know what emergency contraceptives are and how they work. The definition of emergency contraceptives, as given by the University of Maryland Medical Center, is a method to prevent unwanted pregnancy in women who have unprotected sex or when birth control methods have failed. Many people do not know what emergency contraception or the morning after pill is, which also leads to the misconception that the morning after pill is an abortion pill. This is a very wrong misconception that I will get into a little bit later. To start, it is best advised to take the emergency contraceptive as soon as possible after unprotected sex or after protected sex methods have failed. The time frame to take emergency contraception is between 0 and 72 hours afterwards. There are two types of emergency contraceptives. First is a pill that you can take. Second is an intrauterine device, or IUD, that is placed by a healthcare professional. As stated by Planned Parenthood, emergency contraceptive works by keeping a woman's ovary from releasing an egg for longer than usual. This basically just prevents a woman's egg and a man's sperm from meeting one another. Many people do not know what emergency contraception is, which leads to some people thinking that emergency contraceptives or the morning after pill and other emergency contraceptive methods are a means of abortion. Now, people need to understand the difference between emergency contraception and abortion. There is a huge difference between these two. Abortion, as defined by Merriam-Webster's dictionary, is a medical procedure used to end a pregnancy and cause death to a fetus. This is not the same as the effects of an emergency contraception. There are a few ways that abortions are done. First, you can have a pill that you take that terminates a pregnancy generally within 24 to 48 hours after you take it. The abortion pill works by increasing levels of progesterone in a woman and blocking their receptors, which thus destroys the lining of the uterine wall and terminates a pregnancy. The other method is to have the fetus surgically removed by a healthcare provider. Emergency contraceptives prevent an egg and a sperm from meeting. Abortion and other methods to terminate an existing pregnancy do not. Without that connection, there can be no baby. No baby equals no abortion. By people knowing the difference between emergency contraceptives and abortion, perhaps the knowledge can change how others view different family planning methods. Now, I will go into the latest development from the FDA. On April 30th of 2013, the Federal Drug Administration approved for Plan B, a form of emergency contraception, to be purchased without a prescription for women who are over the age of 15. Before the change was made by the FDA, the age restriction was at 17 for Plan B. Many cases and studies were done, and it was noted by the FDA that the data reviewed by the agency demonstrated that women 15 years of age and older were able to understand how Plan B one-step works, how to use it properly, and that it does not prevent the transmission of a sexually transmitted disease. Also, before the change was made, women had to ask for Plan B because it was behind counters and needed to be retrieved by a pharmacist, along with proper identification of age to purchase Plan B. With the new law taken into effect in April of 2013, Plan B was sold alongside condoms in the family planning section of stores that will sell those products, and they do not need to be retrieved by a pharmacist. Finally, the age restriction in which the FDA placed on the purchase of emergency contraceptives should be changed to no restriction at all. I say say this because there are many reproductive age women under and over the age of 15 that can take advantage of emergency contraceptives that still cannot purchase them because of the restrictions for many reasons. According to the World Health Organization, coerced sex, reported by 10% of girls who first had sex before the age of 15 years, contributes to unwanted adolescent pregnancies. And adolescents aged 10 to 19 years old amount for 11% of all births. From an article in Think Progress titled "Why Limiting Over-the-Counter Plan B to Girls Over 15 is Still an Ineffective Policy," the article makes many points that I myself agree with in regard to overruling the policy. The article goes over how the FDA determined that the contraceptives can be used safely by girls and women of any age. This was overruled by the Department of Health and Human Services. This ruling by the FDA basically says that there is no scientific reason why women under 15 cannot safely take emergency contraceptives. Many people have stepped out to fight for women in hopes that the law will be overruled because of lack of scientific evidence, saying that the efforts to retain the age ruling on emergency contraceptives seem to be based on paternalism rather than actual scientific fact. Next, many women are undocumented or immigrants living in the United States and cannot show proof of birth by a birth certificate, driver's license, or a passport. If the cashier at stores are persistent in needing identification and a woman cannot do that, she'll be unable to make the purchase. This can also pose problems for women who are over the age of 15 and cannot show proof of age. Based on the points that I have just stated, women of all ages should be able to purchase emergency contraceptives regardless of their age. Yes, the FDA lowering the age restriction from 17 to 15 on the purchase of over-the-counter emergency contraceptives is a change. However, not large enough to help all women. All people, men included, are affected by this law. Men and women both help put that law into place. The law is detrimental to women still in that it takes away the woman's freedom of choice. So I encourage you all, after hearing all that I have said today, to really think about not only emergency contraception, but family planning as a whole. Think about what this law means for a young woman and the potential life she could or could not have based on this age restriction. Make sure you think about how this affects her whole life, and make sure you have all of your facts before you judge or become cynical of contraception for young people. In the end, the debate over emergency contraception and other methods of family planning will continue to be criticized, whether it be by political or religious officials or by our own opinions. At the end of the day, the choice is no one else's but the person who is put in a situation where they are forced to make a choice. In his book titled Choices, Dr. Shad Helmstetter says, "Learning what to choose and how to choose may be the most important education you will ever receive." This statement is one that I'm sure that many people can find to be true. With all of that said, access to obtain emergency contraceptives in an easier manner is crucial because it has been proven that these methods prevent unwanted pregnancy in women, save money, work well in family planning, and will ultimately have women obtaining the legal right to make their own choices for their bodies. Thank you.